Have you ever heard of the word docere? What it means is teacher, and the English translation of that is doctor. Doctor is a teacher, and if you want to know how to talk to your doctor about your health, then this is the video for you. Hello everyone, Dr. West with possibly a short video but a really important topic, and that is how to talk to your doctor. Because in my office, I never get easy cases. I usually get people that come in that are out of hope, they're out of time, and they're out of options. And one of the things that I always ask them, and whether it is some type of cancer support therapy or Lyme disease or peripheral neuropathy or chronic fatigue or any of these serious conditions that we treat, what is the medical plan in front of you? And so many times people say, well, I don't have any. And I said, well, did the doctor give you some type of recommendation or suggestion? Well, he just gave me a prescription. Well, how long are you supposed to be on the prescription? And the patient will shrug their shoulders. I don't know. Well, what is the plan after that? What are the expectations? And so many times I get people shrugged, and I just had a patient ask me yesterday, how am I supposed to talk to my doctor? And I said, you know what? This is what I would like from a doctor-patient relationship. First, when the patient comes in, it is your responsibility to teach the patient. That's where the word doctor comes from, to teach. And so all of the learning and education, you want to put in front of the patient all of their options for their condition. If they have carpal tunnel syndrome, what do you know about the medical intervention? What do you know about surgery? What do you know about natural interventions and vitamin supplementation and changing ergonomics? And so one of the things that you want to teach people is, what's wrong? Can the doctor fix it? How long will it take? How much will it cost? And how can you make it so that it doesn't come back? Now, I outlined that for a patient. We were working on a peripheral nerve problem. We started getting really good progress. And the patient came in and said, hey, my other doctor said what you're doing isn't possible. And I said, that's true for that doctor, because I don't play by those rules, and I don't fix everybody that comes into the office. But when you have the right doctor with the right treatments, you can have miracles. So you want to make sure that the patient understands all of their options. And so what I recommend patients do when they go visit with their doctor is, number one, is to make sure that the doctor understands their expectations. And so when we do a workup with the patient, I always ask them, walk me through a normal day of your life. What is your target bedtime? What is your target arise time? What are you eating for breakfast? What's the example of what you're eating? What are you eating for lunch? What are you eating for dinner? What's your liquid intake? Do you have any cravings for salts and sugars? Because I want to know how much that condition is impacting the patient, and I also want to know to what contributions the patient is choosing in their lifestyle that's contributing to that condition. Then I'll go through a real quick review of systems. Any pain or symptoms, problems with your feet, your hands, or your skin, or your circulations, how do your muscles feel, your joints, how is your urinary pathways, what's happening with your bowels, do you have any hormone imbalances, blood sugar, acid reflux, heartburn, indigestion, heart problems, lung problems, thyroid concerns or thyroid symptoms, teeth problems, sinus problems, ear problems, vision, double blurred vision, pain in the eyes, headaches, and then how's your emotional health. And if you do that picture with people consistently, it gives you a really nice framework. And then at the end of those questions, I always ask the patient, what are your expectations in coming here? I want to live up to your expectations. And then I'll get a response. And sometimes the patients, I don't have any expectations. Other times they'll say, I want you to make me 18 years old. Other times they'll say, I just want you to take the edge off. And then you understand what people really want. Then you can understand how you can take care of them. I really like it when patients give me their expectations, because now I have a parameters or framework to work within. So when you go visit with your doctor, you want to know, what are the doctor's expectations, what are your expectations, and what is their prediction of, can I help you, can I not help you? And that doesn't always mean that you're going to cure someone, because when people say, I want to be 18 years old, oh man, I'm really good, I'm not that good. Maybe I'm the wrong doctor for your expectations. But then there's some key important questions that I think patients can ask doctors. Number one, are these all of the alternatives and options that you know about for my case? I love asking that to providers when I go see a doctor, or when I take my son or my family in to see a healthcare provider, is what are all of my alternatives and what are my options? I think that the most important question that you ask from a patient to a doctor standpoint, if this is your brother, your son, your mother, your father, how would you treat this patient? What treatments would you do? And what would you like to know about? because a lot of times the doctor will answer that question much differently than if you just say, what would you do? Those are my thoughts on how to interact with your doctor. I forgot to mention that I love it when people come in with a list of questions, because then we can go down the list and you can answer the questions. And I'll tell people, once you leave the office, it seems like all of a sudden your inspiration, your thoughts open up. You have all these questions, write them down so we can go over them on the next visit. Because the more you know about your case and the more you know about all of your options, the better chance that you have to control, to remove the barriers that are preventing you from getting better, and ultimately to achieve and maintain optimal health. Thank you so much for watching the video on how to talk to your doctor. If you liked our video on how to talk to your doctor, please like us, share us, and tell everyone about our channel. We'll see you on the next video.